Despite the revolutionary advances in genomics, the human body remains a frontier of biological complexity, where the genetic code sometimes seals extraordinary destinies. We explore the lives of 7 individuals whose genetic conditions, of extreme rarity and hardship, force us to reconsider the limits of human resilience and dignity in the face of biological unpredictability. Number 8. Sarah Gertz, Ehlers-Danlos syndrome, EDS. Sarah Gertz, 28, has become an essential face for raising awareness of chronic and invisible illnesses. Ehlers-Danlos syndrome, EDS, is a heterogeneous group of inherited connective tissue disorders. Their fundamental cause lies in genetic mutations affecting the production or assembly of collagen, the body's most abundant structural protein. In patients with EDS, this framework is defective, leading to systemic fragility and hyperelasticity. Cutaneous hyperelasticity, which Sarah Gertz highlights, is the most visible aspect of EDS. However, it is crucial to remember that EDS is a deeply debilitating systemic disease. Joint hypermobility, which allows for impressive movements, is the cause of frequent dislocations and subluxations, sources of severe chronic and neuropathic pain. EDS is not limited to the joints. The hypermobile type, HEDS, the most common, is frequently associated with dysautonomia, particularly postural orthostatic tachycardia syndrome, POTS, which disrupts cardiovascular regulation. In the rarest and most perilous forms, such as vascular EDS, the collagen deficiency compromises the integrity of arterial walls and organs, constituting a constant vital threat of rupture. Using her media platform, Sarah Gertz transformed her diagnosis into a powerful advocacy for radical acceptance. Her activism is vital because EDS remains massively underdiagnosed, often requiring years of medical wandering. She deconstructs the idea that illness and beauty are mutually exclusive, proving that strength often lies in authenticity, even when it is physically unusual. Number 7. Marimar Quiroga, the confrontation with cystic hygroma. Marimar Quiroga embodies the avant-garde of inclusive beauty in the digital age. Born with a severe congenital lymphatic malformation called cystic hygroma, her journey is a powerful testimony against the physical stereotypes imposed by society. Cystic hygroma is a rare anomaly that develops in utero. It is a benign growth of the lymphatic system, the network responsible for fluid drainage in the body. When these sacs filled with lymphatic fluid become voluminous, they form cystic masses, most often in the cervical and facial regions. In Marimar's case, this malformation manifested as an extended facial tumor. The medical impact of this condition is profound. Cystic hygroma can impede vital functions. Marimar has had to undergo multiple complex surgical procedures to manage her condition and maintain clear airways. Since her ability to feed naturally and communicate verbally is hindered, she uses a feeding tube and sign language as her primary mode of expression. Faced with physical and social challenges, Marimar was a victim of intense bullying. She chose to channel her inner strength to become a respected beauty influencer on YouTube. This approach is revolutionary. In a media space obsessed with retouching, Marimar uses her unedited image to show that self-confidence is the most beautiful adornment. Her message is clear and universal. True beauty resides in unconditional self-acceptance. She has practiced self-affirmation since childhood to build an essential mental shield, rejecting pity or external judgment. Marimar Quiroga proves that a person does not need to conform to the norm to be a source of inspiration and glamour. She uses makeup as a tool for empowerment, demonstrating that beauty is a matter of attitude and courage. Number 6. Adalia Rose, Hutchinson-Gilford progeria syndrome, HGPS. Adalia Rose was a digital icon, a diva whose short life was marked by a tragically rare genetic disease, Hutchinson-Gilford progeria syndrome, HGPS. Adalia captivated the world with her contagious joy of life and energy, despite the burden of accelerated senescence, aging. HGPS is caused by a sporadic mutation in the LMNA gene. This gene normally produces lamin A, a structural protein essential for maintaining the nuclear envelope of cells. In affected individuals, the mutation creates a truncated and toxic form of the protein called progerin. The accumulation of progerin damages the cell nucleus, leading to premature and ultra-rapid aging. This syndrome is staggering in its rarity, affecting only about 1 person in 4 to 8 million births. Symptoms appear in early childhood: growth delay, loss of adipose and muscle mass, alopecia, hair loss, thin and wrinkled skin. The main danger of progeria lies in the accelerated development of cardiovascular diseases typical of octogenarians. Patients generally succumb to complications such as atherosclerosis, heart attacks, or strokes, with an average life expectancy not exceeding 14 years. Adalia Rose chose not to be defined by this somber prognosis. She became a YouTube sensation, documenting her daily life, routines, and dances with the mischief of a child. Millions of subscribers were drawn to her immense charisma and her capacity to live in the present moment with remarkable intensity. Adalia Rose's legacy is a powerful lesson in courage. She proved that the quality of life is measured not by its length, but by the richness of the moments lived. Number 5. Kayla Hansen, Complex Regional Pain Syndrome, CRPS. Imagine pain so intense that it is ranked at the top of chronic pain scales, surpassing unanesthetized amputation and certain cancer pains. Such is the daily reality of Kayla Hansen, 31, living with Complex Regional Pain Syndrome, CRPS, often nicknamed the suicide disease. CRPS is a chronic neurological disorder characterized by intense and persistent neuropathic pain, often localized to a limb, but capable of generalizing. It usually develops after a minor injury. The dominant theory is that the autonomous nervous system, responsible for stress management and the fight-or-flight response, becomes dysregulated, sending amplified and inappropriate pain signals to the brain. The diagnosis of CRPS is exclusively clinical, established based on symptoms: pain disproportionate to the initial injury, hyperalgesia, increased sensitivity, and allodynia, pain caused by a non-painful stimulus, such as the rubbing of a sheet. These symptoms are accompanied by trophic changes: color, temperature, and texture of the skin, and muscle atrophy. Kayla Hansen suffers from the most severe stage, where the pain is constant and exhausting. On the McGill scale, CRPS is the highest. Kayla describes her pain as an internal fire, causing burning and blistering sensations without external heat. She lives at level 10 out of 10, even under heavy medication. The denomination suicide disease reflects the harsh reality. The incessant intensity of the suffering and the absence of relief unfortunately push some patients to despair. The management of CRPS is multidisciplinary, including nerve blocks and spinal cord stimulation, but it is rarely curative. Kayla's story highlights the urgency of research to find effective treatments against this devastating disease of the nervous system. Number 4. Charlotte Garside, Primordial Dwarfism. Charlotte Garside, originally from the United Kingdom, was once nicknamed the smallest girl in the world. She was born with an extremely rare form of dwarfism, microcephalic primordial dwarfism, a condition so exceptional that it affects only about 200 known people on the planet. Primordial dwarfism is distinguished from more common forms, like achondroplasia, by the fact that growth restriction begins very early, from the fetal stage, and affects all body dimensions proportionally, including the skull, microcephaly. At the age of 5, Charlotte measured barely 68 centimeters and weighed just over 4 kilograms, measurements typical of a full-term newborn. This growth disparity creates enormous medical and developmental challenges. From birth, the prognoses were very grim. Doctors warned that her long-term survival was uncertain. Primordial dwarfism is associated with serious complications, including neurological anomalies, increased risks of cerebral vascular anomalies, and immune deficits. Each day of Charlotte's survival is a victory against these medical expectations. Today, at 12, Charlotte has not only survived, but has integrated into the school system, demonstrating an intelligence and vivacity of spirit that belie her small size. Although she has to face the persistent stares of the public, she and her family are tireless advocates for inclusion. Charlotte's story highlights the extraordinary plasticity of human life. Despite the physical constraints imposed by her genetics, she leads a life full of love and activity, emphasizing that the true measure of a person is not their physical height, but the size of their heart and spirit. Her existence is a poignant reminder of the rarity and preciousness of life. Number 3. Davy Wickland, Lesch-Nyhan syndrome, LNS. Davy Wickland, a teenager from Washington, is confronted with one of the most challenging genetic disorders, Lesch-Nyhan syndrome, LNS. This X-linked condition is a metabolic disease that generates a terrifying consequence: compulsive self-mutilation. Lesch-Nyhan syndrome is caused by the deficiency of a crucial enzyme, hypoxanthine guanine phosphoribosyltransferase, HPRT. Without this enzyme, the body is unable to efficiently recycle certain purines, leading to a massive overproduction of uric acid. LNS is associated with a triad of symptoms: hyperuricemia, causing gout and kidney problems, severe neurological dysfunction, developmental delay, involuntary movements, and the most distinctive and tragic, self-mutilating behaviors. Davy, like all LNS patients, cannot control this internal impulse. It is not a voluntary act, but a compulsive and neurologically wired behavior that pushes the patient to bite themselves, hit their head, or scratch. This compulsion is so strong that patients must be constantly monitored and, unfortunately, often physically restrained. In Davy's case, he must be immobilized in his wheelchair, and his arms must be protected or tied to prevent him from inflicting severe injuries. The impact on families is immense. LNS parents and caregivers must find an almost impossible balance between ensuring their child's physical safety and preserving their dignity. There is no cure. Treatments aim to manage the excess uric acid with medications like allopurinol and use behavioral techniques, although their effectiveness against the self-mutilation impulse is limited. Davy Wickland's case illustrates a daily battle against his own body, demanding an incredible dose of devotion and family love. Number 2. Lalit Padidar, hypertrichosis, werewolf syndrome. Lalit Padidar, an Indian adolescent, lives with one of the most visually striking and historically mythologized conditions, hypertrichosis, known as werewolf syndrome. Hypertrichosis is characterized by excessive growth of vellus and terminal hair on areas of the body normally little or not at all hairy. In Lalit's case, it is a congenital and generalized form, covering the majority of his face and body. This condition is extremely rare, affecting only a handful of recorded individuals. From a medical perspective, hypertrichosis is not physically dangerous, but it is the manifestation of a genetic mutation altering the hair follicle growth mechanism. There is no definitive cure for the congenital form. Attempts at hair removal by shaving or laser are only temporary, and regrowth is inevitable. The psychological and social impact of hypertrichosis is massive. Historically, affected people were marginalized, even exhibited as carnival curiosities, and confused with mythological creatures. Lalit was born into a culture where ancestral beliefs can still influence the perception of difference. He has faced the astonishment and sometimes the judgment of strangers. Nevertheless, his family has strived to offer him an ordinary life. Lalit is depicted as a gentle, kind boy who attends school and enjoys playing with his friends. His story is important because it shifts the perception of hypertrichosis from mythology to human reality. Despite an appearance that some might consider disturbing, it is fundamental to remember that it is only an excess of hair. Lalit Paridar embodies resilience in the face of a major physical difference, proving that a person's identity can never be reduced to a simple dermatological condition. His courage encourages us to look beyond appearance and recognize the humanity behind the rarity. Number 1. The moment of the unforeseen. John advanced into the clearing, his brave smile showing. Long judged for his difference, he had learned to transform every gaze into strength. Nature welcomed him without question. That day, he raised his fists, not to fight, but to celebrate his inner victory. These 7 narratives of individuals confronted with genetic mysteries remind us of the infinite and sometimes cruel complexity of the code of life. Faced with insurmountable obstacles, resilience, dignity, and the quest for a full and meaningful life constitute the true miracle. These existences are an eloquent testament to the limitless capacity of the human spirit to rise above biological constraint.